Good morning, Salam alaikum. My name is Farah, and I come from Somaliland. I'm sure most of you haven't heard of my country, so hopefully by this presentation I will tell you more about where I come from and where I work at, and all the obstacles that we see in the medical field. So this is where I come from, EDNA Aden University Hospital, founded by Edna Aden. As you can see, she's the one in the middle. It's located in the Republic of Somaliland. So this is the map of Somaliland, just in case you don't know. It's located in the southern coast of Gulf of Aden, bordered by Somalia to the east, Djibouti northwest, and Ethiopia to the south and west. So these are just brief information about Somaliland. As you can see, it used to be a British protectorate, like India. We got an independence from Britain in 26th of June, 1960. And 5 days after, Italian Somali protectorate or colony got their independence, and both Somaliland and Somalia joined and became the Republic of Somalia, the Great Republic of Somalia, hoping to join all the Somali regions together. But sadly, as you know, the civil war has happened, and we declared independence from Somalia in 18 May 1991. We are a very small, young country, 27-year-old. Our population is 4 million. Our capital city is known as Hargeisa. Our official language is Somali, but we do speak English and Arabic as well. And our current president is his name is Musa Bihi Abdi. We had thankfully five democratic elections, and he is the newest one. He's been elected in last November 2017. And we are really hopeful that he will do some changes to our country. So as you know, we've went through a civil war, and a lot of destruction has happened. About 95% of the country has been destroyed, has been leveled to the ground due to the civil war. Homes, schools, hospitals were destroyed. As you can see, a lot of people died. A lot of humans were lost. And of course, the obvious, nothing good comes out of war. And, due to the results of war, we didn't have no health workers. Most of them has fled or got killed in the civil war. And of course, there's no doctors, no medical officials, so there's no health care for population of 4 million. No immunization for children, no water supply, no sanitation, and of course, the law and order collapsed. So I will tell you a brief about what happened. Of course, the health in Somaliland is considered amongst the worst in Africa. We have the highest maternal mortality in the world. And of course, we have the highest figures in female genital mutilation. About 90% of the women get mutilated. We have large number of population die from preventable diseases. Of course, the HIV stigma results in reluctance to attending HIV hospitals. And of course, few children receive vaccines, recommended vaccines. And we have a lot of children who die from malnutrition, dehydration. And of course, due to the sad situation, we've been going through one of the worst droughts that has happened in the region. So, to the tragic things that happened in my country, a lot of people a lot of diasporas who fled the country has come back to do change to help the people. And one of them is Edna Aden, the founder of the hospital that I come from. She was she left her leading career in the WHO in Djibouti, and retired at 1997 and went back to Somaliland to build the hospital. This is the hospital, EDNA Aden Hospital in Hargeisa. It opened in March 2002. Next week, on the 9th, we are celebrating our 16th anniversary. It's founded by EDNA Aden Ismail. I'll tell you a brief history about EDNA Aden. She was once the first lady of Somaliland, married to Prime Minister of Somalia, as well as was the previous foreign minister of Somaliland. She worked as well in the WHO. So I'll tell you a brief thing about our hospital. So our hospital, EDNA Aden Hospital, is a non-profit charity hospital. It's built in March 9, 2002, in a former execution ground, an Ndambi site, in the poorest neighborhood of Hargeisa, known as Ahmed Dagah district. Thankfully, now we have a hospital that has inpatient, outpatient, laboratory, blood bank, and radiology center as well. We as well as pharmacy. Initially, the plan was due to the maternal mortality, high maternal mortality. It was supposed to be a maternity hospital, but people, because they see a hospital, they come and seek help. So we became a major tertiary referral hospital for all kinds of medicine. It's a non-profit hospital and a charity hospital as well. Most of our patients cannot afford treatment, so we treat all patients to come to us, no matter their financial situation. Thankfully, now we are ranked number 13 on the top 50 hospitals in Africa. And we have a lot of nice stories to share. We started from nothing, from an execution ground. Now we're a hospital that's have one of the effective neonatal ICU in the country. One of the great stories we have is the story of Tiger. As you can see, he was a premature baby that was born at 28 weeks, weighing 900 grams. Thankfully, due to the good care he got in the neonatal ICU, and after 3 months, he started to weigh 4 kilograms, went to his house healthy and happy with his family. And the other nice stories that we have in our hospital are we have a set of conjoined twins who are now 18 months old, totally dependent on oxygen. They were born in the government hospital, and they're from a very poor family who cannot afford basic medical services. So we got them in. They're actually living in the hospital now, depending on on oxygen. They are sadly inseparable because they share a heart that's mainly made of 6 ventricles, and they share major organs, so it's very hard to separate them. So they are living with the family in the hospital. One of the nice things that we do in our hospitals are we do free surgical campaigns every 6 weeks. So these surgical campaigns, basically we do cleft lip, cleft palate repair, fistula repairs. We insert shunts for kids with hydrocephalus, free of charge. We repair spina bifida as well, clubbed feet, hypospadias, and as well as for obstetrics, we do free cesarean sections for needed patients. And by 2017, we've done 694 operations. And thankfully, we have doctors that come from all around the world to operate together and work together with the doctors and the surgeons in Somaliland. By 2000, so there's a error there. By 2011, EDNA Aden University has opened. It teaches health sciences, including medicine, midwifery, nursing, anesthesia, laboratory, veterinary, public health, dentistry, as well as we have Department of English and French languages. And And we've had, thankfully, last month, we had our first medical postgraduate diploma in obstetrics and gynecology, where 6 doctors graduated from basic obstetrics and gynecology and infant health. And the ceremony was attended by the Vice Minister of Education. But the other programs that we do from the hospital and out of the hospital, we do outreach programs. We do drought outreach programs, providing healthcare to the rural areas that don't have any medical services or many medical centers. We trade something known as community midwives. As I told you, we have the highest maternal mortality, so midwives are needed. So we treat midwives, train midwives, about 444 midwives were trained from various regions and states of Somaliland, where they get trained in our hospital, in the university, and then later on they go back to the regions to help their people. In nutrition, we've been doing some outreach programs where we promote nutritional diets for people we get a lot of people who are folate deficient, and we get a lot of neural defects due to folate deficiency, so we teach people about the supplements that they need. As well as we have an anesthesia department, anesthesia training as well, and we're promoting safe anesthesia in Somaliland, where we treat anesthetics on new machines throughout the country. We've been as well involved in various events that happen in Somaliland. Last week we had a Somaliland International Marathon, and we participated in providing the first aid. So this is our story of EDNA Aden Hospital. If I go back talking about Somaliland and the health services, we do get a lot of patients, but we are deficient in some fields like oncology, cardiology, and urology. And in order to treat patients, we usually need to refer them to go to hospitals in different countries. And that's why I'm here now to see where is the best place to send them to here in India. And hopefully we will get joined together, and of course we'll get some doctors that could come and train doctors in our country. So this is the story, and if you need any more information about the hospital I come from, you could go on ednahospital.org for more further information. Thank you.